السلام عليكم ورحمة الله، ومرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا عن مراجعة أسئلة اختبارات Prometric Review of Prometric Test Question. This is lecture number 12 in Maternity and Child Health Nursing and number 51 in Ghaith Review. Today we are going to discuss 5 questions from question number 272 up to question number 276. معكم محمد اسماعيل يحيى. نبدأ مباشرة. Question number 272. A client in her first trimester visits the prenatal clinic. Which should the nurse say about the patterns of future prenatal visit? The options are number A, once every week for the first 20 weeks. Number B, once every 2 weeks for the first 28 weeks. Number C, once every 4 weeks for the first 28 weeks. Number D, once every 3 weeks for the first 28 weeks. وقفوا الفيديو هنا اختار الخيار البشي والصحيح. The correct option is option number C, once every 4 weeks for the first 28 week. اللي اخترنا الخيار رقم C نشوف rational. The nurse should inform the client that future visits to the prenatal clinic should be once every 4 weeks until the 28 weeks, after which the frequency of visit increases to once every 2 weeks until the 36th week, and then after weekly until the birth of the baby. So the correct option is option number C, once every 4 weeks for the first 28 weeks. Question number 273. What is the antenatal assessment schedule for women from the period of conception to 28 weeks of gestation? The options are number A, once a week. Number B, every 2 weeks. Number C, every 3 weeks. Number D, every 4 weeks. وقفوا الفيديو نختار الخيار بالشوسة. The correct option is option number D, every 4 weeks. اخترنا الخيار رقم D نشوف rational. The schedule of prenatal visit is one every 4 weeks until the 28 week of gestation, and then one every 2 weeks until the 36th week of gestation, and then weekly until the birth of the baby. So the correct option is option number D, every 4 weeks. Question number 274. A nurse is instructing a 20-year-old newly gravid woman about side effect of oral contraceptive. Which of the following, if stated by the woman, indicates for further education? The options are number A, nausea. Number B, headache. Number C, weight gain. Number D, ovarian cancer. وقفوا الفيديو نختار الخيار بالشيء صحيح. The correct option is option number D, ovarian cancer. اللي اخترنا الخيار رقم D نشوف rational. Note the strategic words need for further teaching. These strategic words indicate that you need to select an incorrect client statement. So the incorrect client statement is option number D, which is ovarian cancer, because ovarian cancer is not from adverse effects of oral contraceptive. On the other hand, there is evidence supporting its effectiveness in reducing the risk of endometrial cancer and colon cancer. So the correct option is option number D. The remaining options are adverse effects of oral contraceptive pills. Question number 275. A 33-week pregnant mother is on her routine medications that include iron supplement, folic acid, multivitamins, and calcium supplement. Despite all that medication, her hemoglobin has not been increased since last 2 months. She is experiencing more fatigue and lethargy since past few weeks. Her hemoglobin is 80 grams per liter, hematocrit 0.22. Which of the following intervention is the most desired? The options are: number A, add vitamin C to increase drug absorption. Number B, start injectable multivitamin as ordered. Number C, advise increase intake of organ meat and fortified food. Number D, advise increase food intake by frequent small meal and snack. وقف الفيديو هنا اختار الخيار بالشمس. The correct option is option number A. اللي اخترنا الخيار رقم A نشوف rational. Normal hemoglobin for men is 135 to 170 grams per liter, and for women is 120 to 160 grams per liter. As the hemoglobin below to 80 grams per liter, the individual looks pale and can be short of breath when exercise, with pounding heart and dizziness on standing. So increase dietary source of iron and take an iron supplement as well as supplemental vitamin C or foods rich in vitamin C is the standard practice for management. But recent data suggests that vitamin C might not be necessary to absorb non-heme iron supplement in the body. Anyway, the correct option is option number A. Add vitamin C to increase drug absorption. Question number 276. A primary gravida attended the antenatal clinic for her routine visit. The nurse performed an abdominal palpation and found the fundus to be midway between the symphysis pubis and the umbilicus. What are the weeks of gestation according to the finding? The options are: number A, 8 weeks, number B, 16 weeks, number C, 24 weeks, number D, 28 weeks. وقف الفيديو هنا واختار الخيار اللي بتشوفه صحيح. The correct option is option number B, 16 weeks. اللي اخترنا الخيار رقم B نشوف rational. In pregnancy, the uterus increases in size to accommodate the development of the fetus. At approximately 12-week gestation, the uterus becomes large enough to be palpable just above the symphysis pubis. And at the 16 weeks gestation, the fundus of the uterus can be palpated at the midpoint or midway between the umbilicus and the symphysis pubic. And at week 20 of gestation, the fundus can be palpable at the level of the umbilical. So the correct option is option number B, 16 weeks. شكرا جزيلا، نتقابل في محاضرة جاية. Don't forget to support us by comment, like or subscribe.